Hello, and today we are going to cover some of the topics for emergency medical care. I've gotten some requests on um, some signs that you can use in the medical field, emergency response teams, things like that. So, and it is important, because especially in an emergency, it really helps to be able to talk to somebody. And so I'm going to try and cover some of the basic signs. I have been in emergency situations where I have interpreted quite a bit. So I put together some words that I remember are pretty mainstay and used a lot. Yeah, because especially in emergency situations, you want to be able to talk to somebody as much as possible. Even a little bit of communication can make a huge difference, So I'm here to help you. I'm going to help you. You point to yourself, I will help. And to do help, you put one hand out like this, the other hand, you make a fist, but your thumb is up, and it's on top, help. So from me to you, help. So I'm going to help you, alright? Name. When you're asking for somebody's name, what's your name? Okay, so what's your name? Okay, on top, name. Birth. So from your tummy out on top of your other hand, birth. So like your date of birth. Weight is like this. So it's kind of like name, but it's like a scale there. Weight. Height. How tall are you? Tall. Height. Insurance with an I. It's kind of like a fist, but your pinky finger is up and you shake it back and forth. This is insurance. So obviously in the medical field you're gonna have a lot of that. Medicine. This is very important. So one hand spread out, the other with just your middle finger out and down, touching the palm. Medicine. Okay. How do you feel? What you do is it's kind of like you're making a heart, okay, shape of a heart, but the thumbs aren't touching, okay? Inside and out. So how are you feeling? Feel. Okay, and to do feel, it's the same as medicine, but you touch your chest up, feel. So how do you feel? Okay. What did you eat? And so I've gotten this request because obviously, because if you put something in your mouth, it can make you sick. What did you eat? And when you're talking about yourself or you're talking about somebody else, you point to the person that you're referring to. So it helps with confusion. So what did you eat? Okay. Stay calm, relax. It's okay. Relax. So it's kind of like you're just quieting everything down. Relax. Stay calm. It's okay. Okay. So stay calm, relax. It's okay. Ambulance. This is ambulance. Okay. It is mainly because of the sirens. So you have the lights going around. Ambulance. Helicopter. Okay, so what you do with a fist, but with your thumb up, and then you've got the propellers here, your hands spread out on top, helicopter. So like if you were gonna fly somebody, helicopter. Okay, hospital. Okay, so hospital, you would on the side of your arm, and I think it's because they used to have those Red Cross patches on the shoulder. So hospital. So you do like a cross, the red cross on the side of your arm, hospital. Okay, so this is hospital. Doctor. Doctor. Okay, it's like they're taking your pulse, but with a D. Doctor. And you do it like this, doctor. Now nurse is a lot like that, but you do it with an N. Nurse. Okay, so it's like nurse, doctor. Okay. Emergency. Emergency with an E. Emergency. Response. R. And one, it's like this, response. It's like they're coming. Response. So emergency response team would be like this with a T. Kind of like a circle. You have a crew, like a team there. Team. So emergency response team. Alright. Now some of the symptoms. Okay. Sick. So you do it with the middle finger. Sick. One is up on your forehead. The most important is to have one on your forehead. You can also do one down on your chest. So sick, you know, you don't feel so good. And that's because of like you're checking for fever, you know, so sick. Nauseous. Nauseous is when you have your hand spread out like this on your tummy, and it makes a circular motion, like your tummy's like rocking and it's upset and does not feel good, you know, it's, yeah, nauseous. Okay, they feel nauseous. Cold. Are you cold? So it's like, you know, you're shivering. Are you cold? Chills would be like that. Chills. Fever. Fever. So this is like the old thermometers where you'd have the temperature go up. So fever, you know, like a fever. Okay. Dizzy. Do you feel dizzy? And it's kind of like nauseous, but your head is what's feeling it. You know, you're like dizzy. Okay, so it's like going around like dizzy. Hurt. Now, obviously, this is a big main one. Hurt. Pain. Does it hurt? And you make a fist, but your index fingers are out and they're coming towards each other, so it hurts. Okay. Or pain. Does it hurt? Pain. Hurt. Where? You know, like where does it hurt? Where? And the sign for where is this way because it's like a person that's lost and they're wandering, trying to find their way. They don't know where they are. Where? Okay. So where does it hurt? Okay. This is broken. Broken. So broken bones would be like this. You know, like the ends of a bone. Bone. Broken. Okay. Now, a lot, this is like a great amount, or a little bit. So a lot of pain, a little bit. How long? Obviously, it's important to know like how long this has been going on. So how long? You do it with an L, up, you run along your arm. So how long? Okay, so you could ask, how long have you been sick? And they'll give you a response. Okay. Is it hard to breathe? Hard. Hard is like this. So you make a fist, but index finger and middle fingers are out like this, on top of each other. Is it hard to breathe? And you make the motion like you're breathing. Your chest is up, you know, expanding in, contracting. So breathe. Is it hard to breathe? Or can you breathe okay? Itching would be like this, like it's itching. IV, you just do I and V, and you can show the I. Be like you're sticking a needle on somebody. IV. Blood. Blood. So you have this hand, like this. One will touch your lips. Blood, like it's running down your skin or something. Blood. Blood. Okay, goes like this. How much blood? Okay. This is a sign for heart. Heart. Or heart. And when you're like eyes, ears, nose, mouth, pretty much you point to wherever it is. And usually deaf people are pretty good at gestures and kind of common gestures you'll be able to get by with a lot. So heart, and pretty much you can point to just about any body part that you're referring to, and it'll work. Okay. So, and if they ask you, well, you can always say that you know a little bit of sign, that you're learning sign. Okay, so it'll help kind of introduce. You point to yourself. No, and this is like the knowledge is up there. You're kind of like this, tapping the side of your head. No, a little bit of sign. Okay, and this is, you do it, make a fist, index fingers, sign. So I know a little bit of sign. Okay, or I'm learning sign. You point to yourself in learning. And how you do that is you have basically, like, let's say you got a page right here, and you're taking that and you're putting it inside your head. Okay, so learning. So I am learning sign. Okay. So, and this is please, okay. And you do that with please in a circular motion on your chest. Thank you. And it's kind of like you're blowing a kiss, like an expression of gratitude. Thank you from your lips out. You're welcome is the same as thank you, or you can do it like this, from out to in to your chest. You're welcome. Yes is like your head's bobbing. Yes. And no. Okay. And that should cover some of the basic signs that I could think of. Obviously, if you have any more, please feel free to let me know, and I'll do my best to include them in another video. Okay. So hopefully that helps, and I again thank you so much for your interest, and appreciate it. So I'll see you later. Bye.